very good evening, everyone from New York to you. It is the top of the hour, so we'll get started. I know we have a lot of material to cover today. So thank you for joining and welcome to tonight's ArthritisPower hosted webinar on patient health data and record linkage. Promises to be a really relevant and very important topic, especially in today's increasingly electronic-based healthcare landscape. And so I won't take much time. I'll do a quick introduction. We're delighted to have with us today Hye-Chung Kum, who is Associate Professor of Health Policy and Management at the University of Texas A&M. And she will be presenting on issues and methods used to preserve the privacy of patient data when linking records from various sources, something that we're all very familiar with, especially today. Many of you also are ArthritisPower members, and so this is especially relevant for those of you who are members of ArthritisPower. With that, I want to hand it over to our guest speaker. Thank you so much, Hye-Chung Kum, for presenting today. Just a few quick housekeeping rules before I can hand over to our guest speaker. So you'll notice that you are all on mute. Sorry about that. It's just that we are recording this webinar for those who are unable to attend today. And so we want to make sure that the audio quality is really good. And so to avoid any kind of background noise, we do the muting at our end. So if you do have questions, and we encourage you to send questions throughout the webinar, please, by all means, use the chat box, send them in. We will do our best to accommodate all your questions. That's what these webinars are for the engagement and the interaction. So please feel free to send in as many questions as you like. And once the presentation is done, we'll have a Q&A, and Hye-Chung Kum will take a few questions. So with that, I'm going to hand it over. And once again, welcome and thank you to our guest speaker for spending this time with us today.
Okay, well, thank you. Thank you for inviting me. It's nice to be able to talk to patients about their health records and their concerns about privacy. Hopefully, some of the work that I am doing on better developing software methods that can improve and enhance privacy would enable more research to be done with health data in a more safe manner. So I'm Hye-Chung Kum. This is a PCORI methods funded project where we focus specifically on enhancing privacy when we're doing record linkage. I believe many people on this call have heard of record linkage. Sometimes I'm with an audience where what's record linkage, but just to give a base on this one, this is when at the end of the day, when you're trying to actually make good decisions with data, often data are siloed or isolated. And so to answer more broad questions about what kinds of clinic care are more effective or what has been going on that is more costly or efficient, you often have to bring together data from different, very heterogeneous sources. So, maybe you're looking for records in hospitals, in all hospitals in Houston to see how people are moving around in the healthcare system in Houston. But when you need to bring together databases that are coming from different sources, there's not usually a common ID that you can rely on. So the first step to actually using data to benefit research and clinical care is to bring together data in such a way that we have a bigger picture of what's going on. And that's what record linkage is about. So when we focus on that step, which is how do we build tables, like how do we build the database that are coming from different places? In general, there are lots of computer algorithms that can do things automatically, but there are always parts of the data that can't be done automatically. So often in this process, there is some person making judgment calls on certain messy data. So here's an example where pair 1, you'll see here that this looks like there's a slight difference in ID. So you see the 2 there and a 3 here. This seems to be a junior. And then you might say, oh, this must be a father-son because there's a gap in the date as well. It just happens to be a father-son who has the same month and day of birth, right? So this is a guess. Or in the case of the second records, right? you see here that, this in one table, this first name was Bryant and last name was Madeline, whereas in another database, they were entered swapped. And every other information is the same. So we're going to take an estimate that maybe this was a data entry error. Whereas the last pair, what you see here is, two people, very different IDs, same last name, exact same date of birth date, but there is a swap in month day. This is a female, male, where, one person's name is Sally, another person's name is John. Maybe they're twins. So when you're doing this record linkage task, you have to look at these pairs and decide, are these the same people or are these different? So what you're seeing is that what I'm talking about is there are many issues in data that result in record linkage being more difficult than we would like. And it has to do with issues like, depending on the database, the same real world entity like Elizabeth might, in one database show up as Elizabeth and another database use the nickname Beth. And so then when you try to match them up, they're going to come up differently. There are times when data change over time. So what an often case in the US is when a woman gets married, they often change their last name. So in one database, you have their maiden name. In another database, now it's their married name. Other issues related to not having a common computer ID is that, names that we would like to think are unique are often not totally unique. So you have, very common names like John Smith, or you have twins and family members that have very similar identifying information, except for a few things here and there. And then you have people who have, John the Third, John the Second. Sometimes it's in there, sometimes it's not. These two rows may be actually the same person, just in one database they decided to include the third, and another database they didn't. Or it may actually be the son and father pair. So you have to think about those things. Often, data like social security number is missing or wrong because people don't want to share the correct social security number, as well as just inadvertent data errors that occur from typing it in. So these are the main reasons why when you're doing record linkage, it's not as easy as we would like. This is the slide that actually gives you a big picture on how this is done. Typically, record linkage is done what we call approximate record linkage. So based on stuff that I was talking about, you can see why you don't want to be matching only on a fully exact match. So that's why it's called approximate record linkage. And then we say, I talk about doing record linkage as a human-computer process. So this flow goes like this. If we assume we're going to link database 1 with database 2, these are large databases, and we don't think a person is going to go through all pairs. But what's going to happen is these two databases go into a software that's going to try its best to do automatic approximate linkage. And there's a lot of smart people who build algorithms that continue to improve on this. But in any kind of automatic approximate linkage software, when it's done, it will output 3 different things. It says, I know these are definite records that are this exact same person, and those don't get reviewed. Then they go, these pairs are definitely not the same person, and those also don't get reviewed. But there tends to be some set of records where the computer says, I'm not so sure. I need someone to look at it and tell me if they're the same or not. So depending on what database you have, how messy the database is, how similar the data collection process is, as well as when it was collected, often automatic algorithms tend to cover 75–80%. The manual resolution part, the uncertain linkages, tend to cover 15 to 25%. And you have this process where you have a human interacting with your names and date of birth, this identifying information in this process. So you have humans interacting with your identifying information for multiple reasons in this process. You have them at the very beginning when they're cleaning data, when they want to standardize data so that the date of birth is always in the same format, as well as training people to learn to do these resolutions. So there are reasons why most in-use systems for record linkage always has a person interacting with the database for doing the record linkage. So in this project, what I'm doing is we have 3 aims in our project. And what we're doing is we're actually doing user studies to figure out the best way to disclose what is needed to support good record linkage decisions. That's aim 1. as well as if we do that, we want to be able to quantify any exposure of identifying information so we know what the potential risk can be. And then aim 3 is where we try to actually communicate that to the general public. And I'll go over aims 3 more in a little bit. But to just give you a sense of what the software is doing, we'll talk more about aims 1 and 2 for now. So if you look at the slide, I thought I would share with you for how this is done currently. So if you are a researcher who is working with databases and you have been trusted to do this record linkage, typically there's a lot of paperwork and checking and vetting to confirm that I am doing this correctly. But once that vetting process is over, I do get everything. I get everything, and then I use everything to do record linkage. So this is where, when it comes down to it, for those who are approved to do this, the current status quo is to look at everything to do the best job I can with record linkage. This does expose a lot of identifying information. So at this point, what I'm trying to say is there a process where I can make this better? And you might even think of this as a graduate student, I was doing a lot of this work. Now I'm a faculty and I'm actually the project lead. And I would sleep better if I did not give my graduate students everything to do what they need if they don't need it. So I'm more in the mind of, what can I do to make myself feel comfortable that when I hire grad students to help me do this, that I know that they are looking at what they need to, but not looking at what they don't have to. This is where I want to talk a little bit about the way information privacy works. I think, in particular these days, there's a lot of stuff in the news about Facebook and Cambridge Analytica. All of us, I believe, would like more information privacy for it to be effective, but what is really important for everyone to understand as we more and more get on the internet, working in the digital platform and doing everything online, basically purchasing things, learning things, everything that happens in the physical world is happening more and more online. And when you do that, I talk about it in a similar format as, there was a time in which we did not have highways and cars. And then now here we are, and we can't imagine a time when we didn't have cars and highways. And none of us think too much about getting in a car and driving on a highway. But we all understand that when we do that, we take on the risk of a car accident. I mean, the rate of which car accidents occur and the fatalities and injuries from car accidents is not negligible. But none of us say, well, this is not good, so we're not driving. That's just there's a fundamental risk to driving that we as a society have learned over time to do the best we can. We continue to invest in technology that makes it safer with seatbelts and airbags. Whereas what I call the digital highway, we're in a much more infancy stage. And so people get on the highway, except it's so virtual that it's more difficult to understand. And there's not a good understanding of the fundamental risks of getting on the digital highway. So what we know is that through research on information privacy, lots of math has been looked at, there is a fundamental risk in that if you want to use data, there is a risk to privacy. There is no way to say, I want it all. I want to use data, get benefit from it, but I need full privacy. So what has been shown mathematically is that information privacy is a budget-constrained problem. And the way you have to have a consensus and public discourse about it is to say, we think use of data has this much utility, so we are willing to risk potential privacy budget of this much. So that's the kind of discourse we need. And it's very important for everyone to understand that you can't go to 7-Eleven at midnight and demand, turn off the video camera because I want my privacy. You either can decide to walk in and get recorded, or you can not go in. But it's just not possible to say, I would like the benefit of going to 7-Eleven at midnight to buy what I need, as well as have privacy, so please turn the video off. It's just not an option that's possible. And that's what I'm trying to say. So if you're focused too much on privacy, what often happens is that things are hidden, and so you don't have enough information to make good record linkage decisions. So the linkages that you're making are going to start to be less accurate. And the consequences having not enough information to make good linkage decisions is either you are incorrectly linking different people, like twins and seniors and juniors, Or actually, I've given this talk before, and I've had somebody come up after my talk to tell me that, I'm Andrew White, and, at my university, every time I go to student health, they ask me which Andrew White, because apparently there is 2 Andrew Whites at the school born on the exact same date. And so it's kind of surprisingly, when you start to do record linkage, how many people share common identifiers. So you don't want to be doing that, but that often occurs. Or the other thing that happens is you don't have enough information and you're not confident that these are the same people, then you just default to, okay, if it's not an exact match, we'll just assume they're not the same people. And then what you're doing is you're actually not linking people you should. The consequences of those kind of decisions is, here's an example where I've been on a study where we were reviewing some applications, and it's an FDA approved evaluation to do after drugs make it to the market. They were doing an after study, so they wanted to monitor any harmful effects that of drugs getting used in the market. So it was a database study. And so in this situation, if you decide to be conservative because you're not quite sure if this is the same person or not, and you tend to err on not linking people, basically your rate of harms from the drug is going to really be very low, because it's not that the drug has zero harmful effects. It's just that you haven't been able to connect the dots. And so both linking different people as one person, so that you are thinking that 2 twins are actually one person, is harmful just as much as not linking them. And it just depends on the record linkage research problem that you're using. But all of these are issues because if you don't link correctly, everything that follows from the linked data has consequences. On the other hand, if you focus too much on utility, the issue is that, in this case, if I say focus too much on utility, which is meaning we would like to see as much as possible so that we can make the most accurate decision as possible, then you can think of what we're doing in status quo, which is release everything and show everything, including your social security numbers, right? Then that now becomes a really high risk, especially these days where identity theft is a problem. So as I was using the example in a research study, you can have people that are graduate students who are looking at, identifying informations of thousands of people who have, including their social security numbers, and that would be, I think, considered pretty high risk. It's PHI identifying information. You would like to not do that, but if you need to link data so that you can actually make proper decisions and properly monitor the safety of drugs, what are you going to do? So the question is there a way we can build software and technology in such a way we can balance and find that optimal balance where we can't guarantee everything, but we can get a little more of both? And that's kind of the point of the project that I'm working on. So now I'm going to move on to what are things I'm using, approaches I'm using to try to get a little of both, a more of both. So the first thing that we do is we try to actually use icons. So in this case, here's an icon here. This icon indicates that the first name and last names are swapped. Or in this case, it says, this part of the name is identical, but there's an additional part here called junior. Or in this case, it says, this part of the date is almost everything else is identical, but this was 06 and this is 60, so it's a transpose. Or in this case, it might say, these 2 IDs are very different. So what we are doing is using icons that highlight difference, and we call these markups, so that can facilitate humans looking at this to better detect what's going on in the data. So that's our first thing. And then the second thing we're doing is saying, do you really need to see everything to make your decision? And so what we're trying to do is decide or determine through research what is the minimum necessary disclosure needed to do accurate record linkage. So again, this is just one example where we've looked at this and we were saying, if it was me trying to do record linkage, I know that looking at this icon, the first name and last names are swapped. Does it matter exactly what it says? And I don't think so. The fact that I know this person, these 2 records have the same ID, that they have the same date of birth, these are females with the same race, These icons here tell you how unique they are. So I see that this is a very unique name and that it's swapped. This is sufficient for me to assume that this is a data entry error to say that this is the same person. And I haven't seen anything yet, right? Whereas in this case, I'm assuming I don't need to know this person's first name. All I know is that it's a very unique name and it's the same name. But what I would like to know is that actually in their last name, in one record, it says Junior, and the other record, it doesn't say Junior. As well as seeing that in the date of birth date that it's swapped. So there's a way to close out parts of the interface, use the interface to close out parts of the cells so that you are not fully disclosing everything. And you might appreciate what this means if you assume, so this was a field called ID, and potentially this might be social security numbers. So the idea here is that if I know in a particular record that these two records have the identical social security numbers, that's all I need to know. I do not actually need to know what the social security number is. In this case, I do not know the full social security number, but what I know is there's only 2 digits that are different, and it's sitting right here. This is a lot less risk than when the full social security number is displayed. Or even in this case where the social security number is totally different or sufficiently different, I don't really need to know what the digits are. I just need to know these are sufficiently different to make my record linkage decision. So what we were doing research on is to say, what is actually the minimum necessary disclosure of information that is required to have good record linkage decisions? So this was our first study, and what you can see here is that we did a study with about 100 people where we gave them different amounts of information and we asked them to do the record linkage decision. And what you see here is that this is the quality score. It's how accurate their record linkage decisions were. So you see that all 3 of these bars are about the same. The accuracy scores are sitting at right about 84%, except in these 2, all information was given. So it's 100% of information disclosed, whereas the third one, we had closed things up. So they were only looking at 30% of the information, but yet their decision was about the same. What you do see is that if you actually reduce it significantly, and in this case, the last one, actually, there's nothing displayed. All they have is symbols to work with. You do see the quality of the record linkage going down. So that what we're saying is there is an optimal point at which you can share a lot less than everything, but that you can still maintain the high level of quality in your decisions. So up to there, we were thinking of this as a static page where we were doing things. The last approach, so our approach 3, is actually what I call open on demand. And what we're doing here is the first table here. As you can see, there is not a single thing here that you can see. This is called a fully masked de-identified data. I don't have anything displayed. But what I have are symbols that indicate how similar the 2 records are. And the idea here is if I'm trying to make a record linkage decision, the initial display I get is something like this that's fully de-identified. But as I try to make my decision, I might decide, I'm not so sure about this. What is this 2 thing here? So then you can click, and when you click, you get more information. So you then move to this screen where I get the Junior. If you click here, you might see what those 2 digits are. Or if you click here. So the idea is you start with very little, but if you need to see more, you can drill down to see more until you are confident that you can make the decision. And you can drill down multiple times until you open everything. So this is kind of fully open. And so it's about saying, let's have the ability to drill down when you need to, but when you're starting out, not give you everything. So that's our on-demand opening. And then the last part of our approach is relying on another very important property of information privacy, which has to do with the fact that actually, although information privacy, we think of this as being encryption and secrecy, but it's more natural for humans who want privacy to say, I don't want you to see this, lock this up. The problem with that approach to information privacy is that when you start locking up data, it gets very difficult to use for legitimate purposes, as well as data that's locked up and not used really have bad quality in the data itself. So what is known by many experts in information privacy is, although it might seem unintuitive, information accountability and transparency is actually a more effective way to give people information privacy. And the best example of this is how the credit report system works. So most people think financial information is very sensitive, if not as much as health data. And how our financial data is kept securely is not through locking it up so people can't look at it. It's not through getting informed consent so that you have to sign every time you are applying for a credit card company to inquire about your record. What it does, it relies on the accountability mechanism, which is if somebody needs to look at your financial record to decide to give you a loan or not, they can do so. But then that becomes public record, and you were told, we shared your financial records with these people because they needed to make a decision, and we are letting you know. If this is not correct, please let us know. It also has the mechanism in which you, as the person, the subjects of the data, can periodically look at it, and if the data is wrong, you can go and fix it. So using information accountability is actually a more effective way to provide information privacy, often on most situations, compared to encrypting things and locking things up. And so what we're doing is relying on information privacy and accountability as a way to provide better privacy. And how we're doing that, so here's the last part, our approach 4 is to say, if there is a researcher who wants to use our software to do this record linkage, that's this part, and as I've said, they start with nothing, but if they feel they need more information, they can click and get more information. What we will do is record what you did see. So now here's the new part in my screen where this is a privacy meter, and we track what was opened and what was viewed. So as the researchers are clicking and seeing more, we keep track, and then later, for accountability purposes, if someone asked, okay, I had an identity theft for this person, who saw it, then we have a log that says, here are the people that looked at this person's social security number. And so what we're doing is building a mechanism where we can do audits and monitoring to track the level of risk we take when we're doing a certain research project. And this quantifying of the risk allows for more than that. And what I mean by that is, once you have a way to measure the risk, you can either approve research projects to do record linkage and just ask them to log what they did, or you can upfront say, we don't think you need 100% of the budget. So 100% of the budget means that you have opened everything. We believe on previous experience, most record linkage projects only need to see about 30% of the cells. So what we're going to say is, once you've opened up 30 things, you can't see any more. If you really find that you need more than 30, then you're going to have to come back and explain to us why you need more. So once you start to quantify the risk, there are more mechanisms you can use to guarantee more things about how your data is getting used, while still promoting good use of data for accurate record linkage. So at this point, actually, I thought I would try to see if we can just see how that works. So here's the software where, as you can see, this is 6 pairs. At this point, everything is the default mode, and you can't see. This is a little bit screen, but there is nothing that's displayed. So this is a fully de-identified data set. What you see is, if I mouse over something, if you can notice, if you can watch the meter up here, if I mouse over something, you see the orange. What that says is, if I click, that's the amount of budget I'm going to use. So if I click, that now turns blue. Or let's see. That goes blue. And that says, you've now looked at the date of birth. That means that this much information has been disclosed. If I feel like I still don't know, that's not sufficient for me to make my decision, maybe what I want to do is look at this. Is this a suffix or not? I don't quite, it seems like there's some difference in last name. It seems like there's a lot of things that are the same. This may or may not be a junior or senior situation, so maybe I want to confirm. So again, if I mouse over, you'll see the little orange on top that tells you the risk. If I click, it becomes blue and says, it's a senior. So then you can decide for yourself if that is sufficient to make a decision on whether it's the same or not, or no, I think actually I need to see the whole name. And so what you see is, if I mouse over this, when the first time it was just senior, the risk was pretty small. The little orange was a sliver. Now, if I click, I'm going to see the full last name, and that's why the orange is much bigger, because you're disclosing a lot more. So if I click, now I see the last name, and that turns blue. So I am looking through these, researchers are looking through these pairs and clicking as needed to make their decision. Maybe I want to actually take your attention to this last row here, where what we see is the identical IDs. Whatever's going on in the first name, there are some differences. I can't figure out exactly what's going on. This pair has the same last name. They also have missing date of birthday. So there's not a match, it's missing. So I don't know, we don't have information about their date of birth. Their gender, this is the sex field, is different. So one of them is male, the other person must be female, and then they have the same race. Is this sufficient information to know for me that to make a decision whether this is the same person or not? Not quite. So I'm gonna want to open this name. And so again, if I mouse over this, I guess the meter's a little, yeah, if you mouse over this, you'll see that orange that tells you the risk is gonna be not so much. So I wanna see how different they are, and I click. And the first time I click, what I see is where the letters are different. This isn't really helping me decide what's going on in this row. I wanna make a good decision, so I might mouse over it again, and you see the sliver again. And this time if I click, I get the full name, and this is where I'm looking, and I see, oh, one person is Aaron, the other person is Adriana, and they have a different gender. So I'm going to take a guess, this must be twins, so that they must be different people. And so this is how the software works, is you have researchers, rather than being given everything to make these decisions, what you get is this software, and then you can access the identifying information through this software that's going to control what was disclosed, as well as monitor and capture who saw what for later purposes. So I think that's the main part of the software. The reason I have this slide, so these are the different modes of different ways to display the identifying information, but I wanted your attention on the last box here, where I call this encrypted mode. So my research is one approach to trying to enhance privacy when we're doing record linkage. Another separate way that people are working on is to say, can I encrypt the identifying information for record linkage? And when you encrypt data, when you encrypt IDs, this is what happens to your data. And so things that are very similar, when you look at this, you see they become very different. So approximate record linkage becomes difficult. But because encryption is a mode where you can lock things up, people are trying to figure out if encryption is another way they can do this. So I just wanted you to have a sense of this. But so that was kind of the technology behind what I'm trying to build. But where I need your help is with our AIM-3, is when I release this prototype software, what I would like to do is figure out how to, with this software, also have what I call companion documents that when researchers download my software to do record linkage, that they can use and help to facilitate communication about what they're doing for record linkage and privacy protection. So in particular to this group, I have 3 different documents that I'm trying to have as template documents that go with the software, but the IRB application and the data use agreements are more technical things that I'm working with the experts in those communities. But where I need patient engagement and patient input is to write the privacy statement. So the privacy statement would go something like this. If you had a research project in town that got permission to link all the hospital data in the region, what I am proposing is that they use a software like mine that would enhance privacy, but also have a project website that is public that says, I've been approved to do this study. Here are the people that are looking at your data to do this study. This is why we're doing this study. And it is unfortunate, but it's not possible to actually get informed consent from everyone. So in lieu of an informed consent, what you can still do is have a privacy statement that says, I promise to do X. And so what I'm trying to do is to describe the benefits of using this software in common terms in plain language. And what we're doing for that is running focus groups so that patients can try using the software and try describing it in ways, in languages that make sense that we can put into a privacy statement. So I do want to acknowledge ArthritisPower and Ben, who has been very helpful in recruiting patients to work with me. I appreciate that patients are taking time to learn about record linkage and the technologies I'm using and really helping me. We've done 3 focus groups so far, and we've had some very interesting conversations. I think patients appreciate it that we're trying to figure out how to best communicate to the patients, as well as the technology we're trying to develop so to enable record linkage or good record linkage, but still be able to get some privacy enhancements in this. And so we've had some good sessions. And I would like to actually also acknowledge Jeffrey Curtis. He's at UAB, and I believe he's part of CreakyJoints as well as ArthritisPower. He's Jeffrey Curtis, who does record linkage studies for arthritis patients, is the one who connected me to Ben, and we're come here. So I wanted to acknowledge both of them and thank them for helping me with recruitment. I don't think I would have actually been able to recruit the patients to help me work on this without their help. So at this point, I think I'd like to say thank you. The last thing I want to say is we have one more session. This is an online session, just like you are calling in now. So if you're interested in participating in a focus group where you get a chance to try to use the software a little bit more to get a feel for it, and then help us write the privacy statement that describes the software, please let me know, and you can just reach me on email. It's kum@tamu.edu, so you can feel free to just email me if you would like to participate. But the last session for the focus group is scheduled for next Friday, 6 to 8 p.m. Eastern time. Thank you.
Thank you so much. That was fantastic, actually, and I think it's also a topic that's topics around privacy and disclosure of personal information is so much on people's minds. So that was very timely. We have a few questions that have come in, so I'll do my best to accommodate these questions, and of course, if required, I can always try and unmute the person who's asked the questions. But let's start with this question that comes from someone in the audience, and this is what the person says. So this person says, can you please clarify, are you saying that there is a difference between what information a patient provides and how much information the researcher sees? So between, I guess, provision of information and disclosure on the part of what the researcher is seeing, and how do you ensure this? How would one operationalize this if in fact this is true? And how would you, I guess the third component to this question is how would patients be aware, because it would rest a lot of fears that people have. How would this information be communicated to patients who are in fact providing that information?
Okay, so I think maybe the first part of that question, I would say, I started the talk with what I called a status quo. I believe it is legal today under HIPAA for researchers to get approved. So it's not like everybody's getting it or it's out there. It's just that qualified researchers who have good reasons to link data get approved to do this. And when they are approved to do this, it's called a HIPAA waiver of informed consent. And an independent party evaluates it, looks at the benefit of doing the study, the potential risk of doing the study, which often has a lot to do with, do they have secure computers so that if we give you the data, it's not going to get hacked? But these things are well vetted. And after the vetting process is over, if you get approved, then what you get is everything. And the reason you get everything is because in order to answer the research question, you have to link data. And when you're linking data, you need to have sufficient information so that you are not, when you are counting, for example, when you are counting what is the 30-day reentry rate. So, there are lots of people who talk about ED visits and we want to reduce ED visits. So we don't want to give hospitals credit if they have lots of people coming back. You cannot know the right reentry rate unless you combine data. And so the approved, in the current legal structure and the system in the US, approved people who have correct credentials, environments, get everything. And that's all they have. That's the only mechanism. So the current mechanism is either you are not approved and you can't see anything and you can't do research with data, or you are approved and you get everything. And so what I'm trying to do with my approach is to say, I think there is a better way in between. Giving people nothing and giving people everything is not either a happy option. So if what my research does, actually I can translate it fully so that it's a software that can be used by researchers, then what I'm saying is now researchers can get approved, but rather than getting data that is everything, they're gonna get an account that where they can access the data, but only through the software. And when they access the identifying information through the software, now we have ways to control what they see, how they see it, as well as monitor what they saw and who saw what. Does that answer your question? And
Yep, that was great, fantastic. Thank you. And actually, that's a great segue to our next question. Comes from Carol in the audience, and Carol is one of our patient partners and a former patient governor as well, very actively involved with research. And she says, she asks if the method you're developing is primarily for research, or is it for clinical care as well? And the reason she asks that is because if it is in fact for clinical care, the data obviously isn't anonymous, and there is the whole issue within clinical care where it's shared with other providers. Sometimes patients are not very clear of what that process is. Could you talk a little bit to that?
Okay, so to my understanding of clinical use of data in clinical care, this to my understanding, so I'm developing a methodology for doing record linkage. I think of the use case being researcher because that's kind of where I'm in, but there is nothing about the technology itself that makes it limited to research technology. So if there were hospitals who would like to use it, they can. What is more relevant here to answer the question is, how is data shared? Because that's what I'm seeing in the question. How is data shared in clinical care? And I think I've talked with patients who are frustrated on both ends. Some patients are concerned because data is getting shared too widely without their knowing. And other patients are concerned and very frustrated because it isn't shared. And when you go to care and they can't share it, it gets very frustrating. So I think actually one of the focus groups, we had a lot of discussion about this because one of the patients was talking about how she is used to carrying around a copy of her medical record wherever she goes because it's not shared. And when they don't have historical medical records, it's a problem. So I think the exact rules on when data is shared for clinical care depends on the situation, depends on which state you're in. So there are multiple things layered here. There are actual laws that say here's when you can share data without permission. Often, actually, my understanding of this is the general rule under the federal guidelines is if data need to be shared to give you care, we share it and we don't need to get permission. If data need to be shared so that the insurance company can pay for your care, we will share information without permission. But that's a different thing than saying, so we often, technically speaking, what we call that confidentiality rather than privacy. What we say is, to do your job as an insurance company to pay for care or to do your job to provide good clinical care, you should know this information. So we're going to give it to you. But what is important here is we are giving it to you for you to do your job. You should not be using this information in any other way or telling anybody about it. So that's why we call it confidentiality. It's like talking to your lawyer. In order for you to get services from your lawyer, you're going to have to tell them everything. But you are provided by law with confidentiality laws that say whatever you told the lawyer cannot tell anybody else. And so in the clinical care setting, my understanding of this is when data needs to be shared for clinical care, doctors are able to share it without permission. But often I see, I guess, even though that's true, because of a lot of the conversations around information privacy and concerns, many hospitals and organizations actually are more conservative and tend to not share, and that causes more headaches for patients, what has been my impression.
Great, thank you. And I just want to reiterate, how fantastic it is to be able for us to listen to this information is really very relevant, especially in today's climate. So, and I think this is a nice segue again into the next question. We hear a lot about, especially CreakyJoints. We talk a lot about the importance of patients providing data and patient-centered outcome research. So there are two linked questions here. One is, on one of your slides, you had talked about, this is with the Social Security example, where you mentioned that you don't need to necessarily know everything, just minimum, and the effort is to now understand what that minimum is. Do you think the question that comes from the audience is, do you think that knowing that there is a minimum that researchers actually need, do you think that would discourage patients from providing information? That's one. The second question is, what would you, and I think this is a broader question, is what would you tell patients today about sharing information? On the one hand, they're hearing all the time that it's really important to share information, whether that's about medications or their symptoms or how they're managing their condition or demographics, etc. On the other hand, we're always worried about information being leaked, information not being used appropriately, etc. So could you, I know it's a rather big question, but could you talk a little bit about that?
At the risk of repeating myself, actually, I think that's a really good question. And it's back to my privacy information slide 101. I think it's really important that everyone who is now on the internet, which we don't have a choice really, to understand and I don't even know that I know the full answer to this or fully appreciate what it is, but what I know for sure is there is a fundamental risk of going on the digital highway. Just like there's a fundamental risk of getting in a car and driving. And until we all understand at some level what that fundamental risk is, I think these conversations become very difficult to have. I mean, it's only normal. We want our privacy. We want the safety. And at the current infancy of understanding of information privacy, there's often a dialogue that says, I would like to use data to benefit from it, but I also want you to make an invisible crook. So the conversation is like this. I don't want someone to watch me go into 7-Eleven at midnight buying a condom, but I do want to be able to go somewhere at midnight and buy a condom. So what I need is somebody who's really smart and knows technology to make me an invisible cloak. And what I'm trying to say is, I believe that is not a possible thing that we can do. So you have to understand there is a fundamental risk to using data in a digital form. There's a lot of benefit from it. I think we all benefit from it. And that without that understanding as a society and having that discourse, it becomes very difficult. I mean, what I heard about this, I heard in the news about the Facebook. When this all got out, Facebook started to make, Facebook looked at things and they announced, here's what we're going to do to make things better. Parts of what they're doing is locking the system down. And so I think one article was talking about how Facebook announced that, we're not going to make third-party companies be able to see this part and that part. And the example there was they blocked. So it used to be open. And really, so what I'm trying to say is, think of a building. So think of a public library. There's no locks. So we all go in and out and we look at books and we're sharing books. It's a lively place. We are communicating and sharing information and learning a lot. But one day you have burglars coming in and people threatening things. So then you start to put locks in. When you start to put locks in without really thinking about what the impact of those locks are, what you don't realize is if you put 3 locks on a door, the 3 locks have to be locked and opened for every legitimate use. At the perchance that there might be a burglar that comes once every 6 months. Now, I am not arguing to not lock it. I'm really not arguing to say don't put the locks in. I'm just saying there is no choice. You have to think about, where do the locks need to be? How many locks do I need? And is this a place where I need a lock? And what is the cost of putting in a lock? So these are the conversations that I think that has to occur. And, you know, I think over time there will be better understanding of this, such that we will move away from what I see is there's some incident that occurs, people then all get very upset, and then things are starting to get locked up. But when things are locked up, really everything kind of comes to a halt, and real use and legitimate use become difficult. So then after a little time goes on and we forgot about the incident, locks start to come off again. Because why? We need the data to flow and the information to flow to get good care. And so the locks start to come off again, and then another incident occurs. And then everything goes down again. So what I'm saying is we need to all work together to have a better understanding of how information can flow in such a way we can balance that risk and manage that risk. Oh, hello?
Oops, sorry, I think I was talking on mute. Sorry about that. That was great. I think we have one last question that sort of neatly ties up to exactly what your response was. And the question comes from the audience again, and someone asks, should patients be asking specific questions or looking for specific things when providing data, when providing information? And I just want to spend the last, 5 to 7 minutes on your current slide, because I think it sort of answers that question, where one of the things that we can do, and that your study is doing, is to ensure that dialogue between the researcher and the patient as far as data safety is concerned. So to address and allow patients to voice their concerns, and then for the researcher to find ways to operationalize the patient's concerns so that things work well on both sides. So I'm wondering if you could, if people are interested, people in the audience, people who might listen to this webinar at a later point, if they are interested in participating in your study, could you talk, maybe just give us a 5-minute summary of what it would entail, that 6 to 8 p.m. session, etc. What kind of information they may need to provide, who might be seeing that information, just a brief overview so that people can reach out to you if they're interested.
For participating in this study, actually, we are not collecting any data from you. So this is, you don't have to disclose any personal information to participate in the study, just in case there's a confusion there. But this is where what we're going to ask you to do is we're going to give you a link where you get to play with my software a little bit. And so the reason to do that is after you've had a little time, like 20 minutes, to think about record linkage, try to do record linkage using the software, then what this is a focus group where we answer 3 questions together as a group and build consensus. The first question is what you liked about the software. So what we would like to do is say, post a privacy statement where we would like the privacy statement to be very understandable by patients, and we want to tell them in a non-alarming, honest way what we're doing with the data. So the first question is, what did you like about it? What can we tell patients who ask the hospital, why did you give this data to the research? Or how are the researchers using the data? So we want you to describe back to us in your language what you liked about the software. Then the second question actually is the opposite, which is, you've used the software, it seems to do better than disclosing everything, but I still have concerns. So what are those? What are the concerns you still hold? And try to help us use plain language to express whatever our concerns that might still remain when you're using the software to access the identifying information. And then the last question we answer together is to say, is there anything else more that you would like to know when you hear, in town, there's a research study going on, they've got identifying information and they're linking things. Is there anything you would like to know? And so what we're doing is running a focus group where you get to experience the software, and then you're going to help us answer these 3 questions. So what we do is actually we set up a hypothetical scenario, and really what I just described is the scenario. We say, you got an email from a local hospital that said, will you give informed consent for this research study to link your data? In order to link your data correctly, we need to release identifying information. Is that okay? And if we release this information, they'll be accessing it through this software. So then the question goes like this. Your neighbor also got the same email, but the neighbor didn't have a chance to use the software and you did. So the neighbor is now visiting you and asking you, can you explain the software to me? What did you like about it? Are you still concerned about it? Is there anything more you'd like about it? So what we're trying to do is have you describe the software, like learn the software and describe the software with us for 2 hours. And we're going to do this. We've done the 3 groups. So what we're going to do is do that and then try to distill the language in such a way that we can describe this in plain language. And then I did want to address the question, what should or can patients do? That's a very difficult question. In the current way things are, as we talked about the question about clinical care, at the moment, informed consent does not seem to be the way this can go. And what I would like to say is just consider, or maybe this is, I believe this is a group that is interested in research so that you are more aware of the kinds of way we think about what research is doable, what research should be done. So the way I think of this is all research has risk. The question is the risk worth the benefit? And so when we think in those terms, the honest answer that I feel as somebody living, in this day and age with you is that this digital age, the risk of disclosure or risk of hacking into your system, as I think one of the questions came up, the credit report's not a good example because they've been hacked. So what that tells me is every single computer system has been hacked. It doesn't matter if it's a hospital, it doesn't matter if it's the US federal government, every single system is hacked. So then the only question I have is, does that mean we should just close down all computers? Probably not. So what can we do? We'll have to live with the risk. And at the moment, I think everyone is working on finding better solutions. Probably the most close to what you can do now is to use those identity monitoring services that will monitor your data. So, I think it's now, many people sell those services to keep an eye that, and what they're doing is not really blocking hacking. They're basically saying your data is out there. It doesn't matter that the researchers aren't getting it because we didn't get approved. It's out there because it's out there through many, many ways, right? The data is out there. The data is used for lots of things, for lots of not so great things. So blocking researchers from your data isn't really protecting your data very much, is my perspective on this. And what you can do is, though, buy services that are not that costly, that monitor your data out there so that when somebody uses it wrongly, that you know it as soon as possible and you can do something about it.
Wonderful. Thank you. Thank you so much. This was all great information. Thank you to the audience. We had great questions from the audience. I know we're 2 minutes from the hour, so I want to end this by saying once again, thank you very much, Hye-Chung Kum. And we will, if you're interested, for those in the audience, if you're interested in getting involved in the study, feel free to email me, email Ben, email Hye-Chung Kum. I'll keep the slide up for a few minutes after we end this webinar, so you can take down the details. But of course, feel free to reach out to any of us regarding that. With that said, thank you. Have a great evening or afternoon wherever you are, and we'll be in touch with you soon. Thank you very much.
Thank you very much.